Good morning, Catherine. Thank you for coming to our allergy service. I was wondering whether kindly you can answer some questions for us.
Absolutely.
Can you tell us about your experience at your first appointment with the allergy service at Salford?
I can. It happened shortly after COVID, so I wasn't able to come to the hospital at that time. But I received a phone call. I received an email, first of all, telling me to anticipate the phone call, and spent, it must have been over half an hour, 3/4 of an hour on the phone to a specialist nurse who talked to me, in detail about the treatment that I was about to receive. More importantly for me, to start with, she was able to discuss with me the actual incident that had started the need for the treatment, i.e. the anaphylactic shock that I was subjected to following a wasp sting. And nobody up until that point was able to talk to me about that. The nurses at the local hospital had no knowledge, had never been involved with anybody who'd had anaphylaxia. And reading about it is one thing, but to have somebody with specialist knowledge who was able to reassure me, and more importantly for me, able to tell me what I could do to protect myself moving forward until that treatment started. And it was about protecting myself and make sure that I had measures in place. Things that I took for granted, like checking clothes and items before I put them on to make sure that there were no wasps in there, so that I could make sure and minimise the risk moving forward. She also explained in considerable detail about what the treatment would look like, how long it would take, how many times I would have to attend Salford, and more importantly, I think at that point, asked me was I ready to commit to that level of treatment, because those appointments would be set in stone, if you like, and whilst there is flexibility if something happens, I did get COVID at one point, for example, and understandably it was delayed, the treatment demands that I was able to honour those appointments, and she was able to secure that commitment from me at that point.
How did you feel about your diagnosis and the way it was communicated by the team?
The diagnosis itself followed a test that I had to make sure that it was specific to the wasp venom that I was allergic to and not bees also. And I think at that point there was time again taken and I felt reassured that the staff that were here, that are here, are incredibly knowledgeable, very calm, very self-assured, and able to reassure me that what would happen and the medicines that would be used to manage my treatment would be effective in the treatment of this particular allergy that I had. And I felt very, very comfortable and very confident moving forward that I would be looked after in the way that I have been.
What were your first experiences of starting your immunotherapy treatment on the day unit and communications with the specialist nurses?
I was very nervous actually. I was very nervous when I first came. I knew that I got my husband to bring me. I knew that I had to be here for an hour, that I'd have the injection at the start, but there'd be an hour and I would be waiting just in case the anaphylactic reaction happened again. And I was apprehensive, I must admit. That was unnecessary, but I was reassured again that, and there were staff here all the time. When you're actually receiving your treatment, it's very, very quiet, it's very spacious, it's very light, the room that we're in, and always on view with the staff. You're never out of sight. And when I was first here for my first appointment, I needed to be able to see the staff. I needed to feel like if something happened and it suddenly started again, that I'd have immediate help, and I felt that from the start, that the environment and the staff that were here, the close proximity, everything made me feel safe and secure.
What do you think about the environment?
As I've said, I think it's perfect. Within the hospital itself, it's a small space, very, very comfortable. I mean, you're not waiting for a long time. It's private when it needs to be, so there are screens round if anybody does require the privacy screens, but also within close proximity of that nurse's station, which is no more than, 3 or 4 metres away, to make sure that we can, if we do need the help, and we can get it very, very quickly.
Do you have any advice and tips for patients who may experience a similar journey to yours?
I think one of them, and it's taking the word journey literally, is what I didn't do, and this was my fault before I started. I hadn't been to Salford Royal before, and this is a big hospital. It's a big site, it's much, much bigger than the local hospital. And I went to the desk in the centre of the hospital itself, and there was difficulty then trying to find out exactly where. But I hadn't researched and looked at the necessary information. It's finding it precisely which building that you're in before you start. The appointments are always prompt. I've never ever been delayed waiting for an appointment here. And at that day I was starting to get anxious because I was delaying the appointment whilst I was on site. And the other thing to remember as well when you come in for the first time is to know that it can get incredibly busy, the car park. If you are planning on parking, give yourself sufficient time to get here, because the tests that are done beforehand, you have to be calm when you come in, and that is measured at the start and at the end of your appointment. And if somehow you become agitated, as I was becoming agitated because I was late, it can have an unnecessary effect. And I think it was, for me, the journey, if we come back to that word, would have been much, much better if I had done the homework needed beforehand to find precisely where I was going.
Is there anything that we could do as a service to improve your care and experience?
I honestly don't think so, and I've thought about this, and I think one of the things that has reassured me, again I keep using the word reassure, but it's important, is the amount of times I have been asked while I've been here, and others, I've seen, not just me, obviously, other patients who've been here have been asked for feedback. And it's when you come in somewhere for so long, the same nurses are here every time I come. It's not a changing shift of nurses who I don't know. I know the people who are here. I know that I can ask questions. I know that my questions will be answered. And the fact that I'm constantly being asked for feedback in a day such as this means that I can see that the service develops and change in response to patients, and not what the nurses, the specialists, the nurses assume is what is needed. They ask the patients first. And I think you can tell that there's the benefit of that. I've never, people may have, I don't know, adverse comments about the NHS, and I'm an avid supporter of the whole system.